Hello and welcome to Cville360, a show to inform and engage the Charlottesville community. I'm Brian Wheeler, Director of Communications for the City of Charlottesville. We do have a number of questions coming in, Chief, but one maybe, what are the current objectives of the city's leadership when it comes to this incident?
Right, so we've got four primary objectives. One is to sustain essential operations of local government, policing, fire protection, fire response, emergency medical services, keeping the lights on, keeping the water flowing. So essential services have to be maintained, and that's really the posture that we're in right now as a local government. We really, related to that, have to work hard to protect our workforce. As people may have seen on television or in the media, there is an increased risk, particularly for first responders. And we have a limited number. There are 95 members of the Charlottesville Fire Department, for example, just one of the agencies that's involved. And if we lose 20 or 30% of the workforce through exposure to COVID, that has a dramatic impact on our ability to provide service. So workforce protection and support for our workforce. We have employees across the city, essential employees like firefighters and police officers. We do this kind of thing on a fairly regular basis, not in a pandemic environment, but it's not unusual for us to be working in a disaster scenario. For many of our other employees, though, this is a unique experience, and many are teleworking that have never done that before, and they're concerned, and we have to make sure that we're supporting them for their own, intrinsically, but also because our workforce is going to be key to getting us up and back and running again when we get to that recovery phase, whenever that happens. The next thing is we're very cognizant of the need to identify and protect and support the most vulnerable in our community. So our homeless population, people that are housing unstable, people with chronic medical conditions, people with addictions, people that are at higher risk for complications from COVID and other infectious diseases, people that are over 60, people that are immunocompromised, pre-existing conditions, and for example, school children. There was a lot of concern about how are we going to feed kids when the schools were canceled. So just a couple of the issues there. And then I think the overarching objective here relative to a pandemic is protecting the healthcare system. I think everyone who's listening or watching has heard about flattening the curve. And that's true, and that really is driving our strategy here locally as well. And the reasoning behind that is that the system itself, hospitals, hospital beds, ICUs, ventilators, staff that can manage patients that are that sick, has limitations. There's a cap. So if we can extend out the total number of cases and the total number of infections over a longer period of time, that will give the healthcare system the ability to adapt, to flex a little bit, to be able to provide the appropriate level of care for people who come down with the COVID disease.
Yeah. Talk about some of the positive things the city has done, our human services group in particular. I know they've worked with the folks that participate in POCHM and having an alternative housing facility for them. What kinds of things have been happening?
Sure. So that's a great example. So POCHM, if people aren't aware, that's a process, a program by which community churches in the Charlottesville area support our homeless population during the cold weather months. And it rotates a couple of weeks at a time to various churches and parishes and around the city and the county. One thing that was identified very early on by our human services and social services professionals when they were looking at that population was we needed to be able to provide particular care for those folks in one location. Because if they were to get sick, having them travel around to other locations in the community would just expose more people. So in a partnership with the folks that are normally in charge of POCHM and some of the folks that we've talked about at Human Services and many other agencies, they've identified a city facility that we'll be able to use. It's centrally located. It's near other services that population tends to draw from and appreciates, and and adds value to their lives. So that's just one small example of the level of coordination that's required for just one small vulnerable population.
And then I know the grassroots efforts by community members have been pretty impressive as well. What have you seen on that front?
Yeah, so some wonderful people in the community set up a website called supportcville.com within the last week or 10 days. One of the primary issues that the community has understood now for certainly the last week is the challenges that we face with personal protective equipment. And that's true in the hospital, that's true for us as first responders, police, fire, EMS. But there's a particular part of the medical community of the healthcare system that was really not addressed in terms of PPE, and that was unaffiliated medical providers. So doctors, nurse practitioners, other providers out in the community that weren't necessarily tied to a major practice or to one of the large health systems. So a series of phone calls and Twitter messages and really almost entirely community effort, they were able to stand up within the framework of that Support Cville website, an element called Equip Cville. And the idea is to simply connect people that have PPE with people that need it. So clinicians, providers, medical providers that have a need for personal protective equipment go to that site and they fill out a form that identifies, who they are, what their level of practice is, where their practice is. And then people in the community that have PPE say, I want to donate. And then those are connected together sort of on the back end. One of the really fascinating things that people are figuring out now is that there are a lot of people in the community that aren't medical professionals that have PPE. So painters and people that do drywall and welders and tattoo parlors that have surgical masks or medical gloves that are stepping up and saying, I don't need these right now. You guys need this more than I do. So, and one of the things that's just absolutely incredible about those community solutions, and I mean this seriously, every time a community member or a community group solves the problem on their own within the framework of a disaster setting, it keeps that scarce resource that we have, that fire engine, that medic unit, that ambulance, that nurse, from having to deploy into that environment. So we are very, very excited when we see that type of organic community solution.
It has been real helpful, and I've seen where some of those suggestions even came to the communications department. People were asking how we could help, be a centralized resource. And the reality is, as you said, we are have essential staffing only, reporting to work. A lot can be done remotely, but a lot of this communication effort and just coordinating with each other is more difficult, and we're all trying to get used to that. And I think in this first week after the declaration of emergency, I was telling somebody over the weekend who called and said, how can I help? And I said, well, keep in mind that this first week, and this is a marathon, as you keep saying, we're just 1 mile in or 1 week in, and let's understand that a lot is being demanded of city staff right now on all fronts. And later this week, on Thursday, we'll have Mayor Walker and Dr. Richardson talk about the city's operations and where council is going to go next. But with today doing this program, I think we finally have been able to surface and get a little bit of air and figure out how can we innovate and reach out to the community in a little different way.
Sure.
So I definitely appreciate all those people on the outside doing things on their own. We are in this together. And that website you mentioned, I think you might have said Smart Cville, but Support Cville. Supportcville.com is where people can go and learn about that.
If I could, one of the things that's really important for us as city leaders, particularly those of us that are in emergency management roles and leadership roles in public safety, is information. It's critical that the community provides us with information about what's happening on the ground, right? So we can't know everything that's happening every minute of every day. So if we're missing a vulnerable population, if we've established a way of doing business in this environment that's not working, we need to know that. And the same thing is true of resources. This environment is won or lost. Activities in this environment are won or lost by two things: information and resources. And they're linked together. So our situational awareness absolutely depends on our community being honest with us, and us being transparent about what we can and can't do. So it's a two-way conversation. So I'm really glad that we're doing this.
And we are working together as a region as well. So while the city has its own communications department, and I've been focused on city communications, we've also put some of our team at the Regional Emergency Operations Center to help support the health district. And really the Thomas Jefferson Health District is the place to go to get the facts about what's happening here locally when it comes to coronavirus.
That's absolutely true. And in our planning, we always begin by talking about who the lead agency is in a particular risk discipline. And in this case, in a pandemic, it's the health district, it's the health department. So we're supporting their operations in every way that we can.
We've had a couple questions come in over the webinar. It sounds like we have fixed the audio on the other broadcast, so we appreciate your patience if you're just now joining us. If you want to ask a question of Chief Baxter, you can do that in the Q&A portion of the website if you want to type it out, or you can raise your hand and I will attempt to bring you onto the call, and you can ask Chief Baxter yourself. But one of the follow-up questions about Pacham, Chief, related to the Key Rec Center, and is there not enough space there to have a safe distance? And I want to make sure everyone knows we are practicing our safe distance here. So let's make sure. Yep, I think we're pretty good.
Good?
6 feet.
All right.
All right, good.
My understanding is that yes, there is, but that's that's something I can certainly find out from the Human Services branch. It's a great question. It's something that we are all adapting to. I can tell you in the Emergency Operations Center now, on every table is a sign that reminds people to stay 6 feet apart. But that's certainly something I can follow up on and find out.
We have another question about quarantine facilities, and what is the community looking at,
Right.
and why would we need those?
Right, so there's multiple reasons to look at housing. So, for example, we are looking at, as a region, how do we house healthcare workers and first responders who need relief, who can't get home because their shifts are so long that it doesn't make sense for them to go home. But also housing for people that are required to be quarantined or to go into a self-quarantine and don't want to or can't go back to their primary residence. And then finally, the third phase of that would be isolation. So someone who actually is suffering from the disease itself and need to be isolated. And as you can imagine, it's not just finding the facility itself. It's got to have the right kind of HVAC system. We've got to have the ability to provide showers and restroom facilities, and provide for food and medication. And it's a significant logistical effort that's underway right now to look at every possibility in the community, from hotels to other large facilities, dormitories. Everything is on the table at this point.
Great. I'm going to invite Nolan Stout from the Daily Progress to join us. Nolan, can you hear us? And do you have a question for Chief Baxter?
Yeah, can you hear me?
We can.
Yes.
All right. I guess my first question was, do you know if any of the city's public safety workers have been exposed or need to be quarantined yet, or if everyone's in good shape right now?
We currently do not have any city public safety members in quarantine.
And does the department, I know that the hospitals have been talking a lot about PPE. Does the department have enough PPE?
Yeah, so that's a moving target. We have enough right now. Can I envision an exponential growth of patients in our area based on what we've seen in other communities that might lead to a situation where we don't have enough? Yes, that's conceivable, and it's something we're working very hard to plan for, and I mean, that's ultimately a national issue. We did receive information yesterday that some of the strategic national stockpile of personal protective equipment has been released to the Commonwealth and is being routed down to designated emergency response agencies, DERA agencies, of which we are one. But the amount there is not significant. So we are also looking at alternatives, which include one of the things we have in our department as a normal organic part of the Charlottesville Fire Department is a very robust hazardous materials team. So we have protective equipment that can be reused safely that we could move to if the situation became dire enough that we were literally out of the correct kind of PPE.
And I know it's kind of early in knowing how this is going to affect next year's budget, but have you guys started to look at the budget requests that you had for new personnel and how this might affect that?
No, we're focused right now from a budget perspective, as a department head anyway, on sustainment through the end of FY20, and then we can think about FY21. FY21, we're beginning to think about this as a 6-month process at a minimum. If we're in this state that we're in today for the next 30 days, if that's 60 days or 90 days, then the recovery is probably an equivalent number of days. And so I think the other thing that's a big unknown is what type of federal legislation and federal funding might be enacted, the legislation might be enacted that would flow down to the states and ultimately to the localities. This is the type this is I was going to say once in a generation, but this hasn't happened since 1918, so that's many generations.
Yep.
And I would hope that our legislative bodies locally, at the state level and at the national level, will be thinking about legislation that supports not only recovery, but also supports positioning our communities in a way that not just if, but when this happens again, that we're better prepared.
So, Nolan, on Thursday, you'll get a chance to ask questions of Mayor Walker and Dr. Richardson as well about the budget. But I do think it's important to note that this has happened when we have 4 months left, in our current fiscal year, but right in the middle of City Council trying to approve a budget. It's uncharted territory for every locality.
It is.
And we have to look at how we can convene City Council again to hold a meeting and make those key decisions about the budget and the tax rate. And we're still figuring that out, and I think everyone is. One of the reasons we're trying technology like this is to get really good at it and make sure that we can reach people and still invite them to participate in our council meetings in the future. So this is sort of the next step, and it's great to have the media asking us questions via this vehicle as well. Other attendees, if you're listening and want to ask a question, you can raise your hand. You can type a question anonymously if you want in the Q&A portion on the webinar, and I'll be happy to call on you. While we're waiting on those, Chief, I'm curious personally, on a personal note, for your family, I mean, what has this been like in your household?
So my wife Barb is a nurse practitioner and was a flight nurse and a medic, and our daughter Kate is a volunteer with the Charlottesville MR Rescue Squad, a UVA nursing school grad as well, and both my wife Barb and Kate Barb's a nurse practitioner in an intensive care unit at UVA, and Kate is a nurse in one of the ICUs at UVA as well. And so you can imagine, even before this, the conversations at our kitchen table really centered on things that are probably a bit unusual for most families. But this is different. I think there's a level of concern based on sort of individually on each of our roles, but then collectively, I know that, I have concern about both my wife and my daughter operating in that environment. We've heard stories and seen videos and read a lot about what our providers are facing, not just overseas, but in the United States right now. Just having to make really difficult decisions and taking great risk in environments where PPE is limited and the particular treatment course for this disease is not crystal clear at this point. So there's a lot of anxiety, and that includes in our house as well.
So Nolan Stout had a follow-up question about the number I reported from the health district. And the number we received from them was 16, but to be clear, 14 of those were lab-confirmed test positive cases, and another 2 were what they would describe as clinically positive. Those patients were exhibiting those symptoms and had been around people, I gather, who had been tested positive.
Right, they had had an exposure to a known positive COVID-19 patient, that's correct.
So, Nolan, that's the difference between the 14 and the 16. Want to make sure we share with the viewers a couple resources. The city's website, charlottesville.org/coronavirus, is where you can see everything that's happening in the city as far as closures, schedule changes, and resources out in the community. 2 key resources are 2 telephone numbers that we want to make sure you know. One is staffed by the health department and our volunteers at the Emergency Operations Center, and that's the COVID-19 hotline. That number is 434-972-6261. And then the city has been really involved in a community resource line. This line is available for people who really need emergency assistance right now, and that number is 434-234-4490. Again, I think 2 helpful numbers. One, if people have a question about where to find a resource, I think folks on both of those lines can be helpful, whether you need advice about a medical condition or you want to call with a COVID-19 question, or if this is making your life really difficult and you are on hard times, and we know that that's going to happen to many people in this community.
That's true. That's absolutely true.
Another thing I said early in the show, and folks who join later may not have heard, is that we will do this again on Thursday at 4 o'clock, and we will have Mayor Walker and City Manager Teron Richardson, and we'll have them participate. The mayor will be remote, so we will bring her in via the webinar. And again, for those on the webinar right now, if you have a question, you want to raise your hand, be happy to call on you. We have another question about the personal protective equipment being limited, and are those sort of homemade masks, are they a useful tool?
I wouldn't say there's no use, but there's no proof that they do provide any protection. And the real risk there is if someone uses something that's not been tested to provide a certain level of protection, they will be more confident in going into areas and exposing themselves to a risk that they would otherwise avoid if they just stayed home. And again, ultimately the solution is the release of available supply down to the local level and to the people that need it the most, that are at the most risk. At the same time, efforts to produce PPE at a rate that will begin to backfill that supply, that fixed amount. And I know people have been using World War II as a comparative, and as a healthcare provider and the husband of a healthcare provider and the dad of a healthcare provider, I'm strongly in favor of repurposing a lot of the might and the intellect and the talent and the capacity of this country to do this. This is not a technical problem. We know the answer, we know how to make it, and we just need to get it done. And
is it fair to say the Charlottesville, Albemarle, UVA area is asking for these resources?
Yes,
Yeah.
that's a very fair statement. We have already sent up requests through our regional EOC, through our Virginia Department of Emergency Management regional rep to the Virginia Department of Emergency Management. That was one of the first requests we made.
And I know you talked about the grassroots effort in, with the supportcville.com website and people gathering equipment. I mean, that's also happening within the city. You know, at our morning briefings, I know
Yes.
we're asked, you know, about the inventory of whatever is available within each department in the city. So we've also got people going through all of our closets trying to make sure we're gathering up everything that we have, and definitely would encourage others in the community to do the same.
Yeah, and one of the things that we have to address in terms of PPE also is, you know, we've still got utility employees that are going out into homes to make sure that people have, you know, gas service, and so they're going to be in people's homes. So there are circumstances where they're going to need personal protective equipment and training in how to operate in an environment that requires social distancing. So we're asking our folks to be, and the community to be, very flexible and very creative in figuring out how to navigate this uncharted terrain.
Chief, I want to thank you for being the first
Sure.
participant in our pilot broadcast here.
Absolutely.
I know on the technical side we've learned a few things in the process, so we appreciate you being a part of that. And then, you know, the first official episode, of course, has to feature my boss and my boss's boss.
Sure.
So that's why I was able to sneak you in, and we'll call it a pilot.
Okay.
To bring you into this this first broadcast. But thank you for everything you're doing,
Absolutely.
serving this community, and being a leader as our incident commander in the city, and then representing us in the regional effort as well. We really appreciate it.
Well, thank you for having me. It's been a pleasure talking with you, and I look forward for other opportunities to communicate with our community about what we're doing and what we think we're doing well. And as I said earlier, if we're missing something, we need to know.
Great.
Everyone stay home.
Thank you. Thank you for watching today.